Erica Jackson. I'll be doing my physical assessment video for today. I've washed my hands. I checked the patient for immediate distress. I checked for level of consciousness, appropriate or response, facial expressions, speech. Can you tell me your name, the date, why you're here, and where you are? I checked the head, face, and scalp for hair distribution, lesions, and color symmetry. I inspect the eyes for color, edema, symmetry, and alignment, and any assistive devices. I inspect the ears for size, shape, and lesions, and any assisted devices. I inspect the nose for shape, symmetry, congestion, and drainage. I inspect the mouth for oral mucosa, the hard and soft palate, the gingivae, the lips, and I note if he has any dentures. I palpate the carotid pulse on each side for 1 minute. I inspect the anterior chest at a 45-degree angle. I access the PMI for 1 minute. I then inspect the thorax for asymmetry, thoracic expansion, note any accessory muscles. And then I listen to the lung sounds. 6 in the front, 10 in the back. I question the patient about any cough, sputum, if so, any discoloration, any shortness of breath with activity. I check the hands for hand grasp. I check for the capillary refill. I check for sensation and movement in both arms. I check the radial pulse and the brachial pulse on both arms and check for temperature. I then go to the abdomen and I inspect for the contour, characteristic, and shape. Then I also take for the 4 quadrants. Then I palpate the 4 quadrants. How was your appetite? When was the last time you had a bowel movement? Any nausea, vomiting, any constipation or diarrhea? Any problems urinating? You don't have a catheter present. Then I go to the lower extremities. I check for color and edema in both feet and both legs. And then I check for sensation and movement. I check for plantar flexion and dorsal flexion. I check for Homan sign. I check the pulses, the dorsalis pedis, and the posterior tibia. I inspect the femoral pulse and the popliteal pulse. I will assess the skin throughout the assessment. Are you having any pain at the moment? I inspect for IV access, O2, any NG tubes, any feeding tubes. Are you having any pain at this moment? Can I get you anything? Bed is at lowest level. Call light is within reach. The bedside table is within reach. And I've washed my hands.